Hey everyone, and welcome back to the channel. Today, we're diving into a topic that affects so many of us as we navigate our wellness journey, our smiles. Specifically, we're going to break down the world of replacing missing teeth. It can feel overwhelming, but don't worry, we'll explore the facts together in a way that's easy to understand. Let's start with the big question many are asking: implants versus dentures. These are two of the most common ways to replace missing teeth, but they work in very different ways. Think of a dental implant as a permanent solution. A titanium post is surgically placed into your jawbone, acting like a new root for your replacement tooth. Once it fuses with the bone, a crown, which looks and functions like a natural tooth, is attached. Now, let's look at the pros of dental implants: stability and security. Because they're anchored in your jawbone, implants feel incredibly secure. You can eat, speak, and smile with confidence, without worrying about them slipping. Natural feel and function. Implants are designed to mimic the look and function of your natural teeth. They allow you to bite and chew with similar force. Bone health. This is a big one. Implants stimulate your jawbone, preventing bone loss that can occur after tooth loss. This helps maintain your facial structure. Longevity. With proper care, dental implants can last a lifetime. No impact on adjacent teeth. Unlike some other options, implants don't rely on neighboring teeth for support. Of course, there are also cons to consider. Cost. Implants generally have a higher upfront cost compared to dentures. Surgical procedure. Placement requires a surgical procedure, which comes with associated risks and a healing period. Time commitment. The entire process, from initial consultation to final crown placement, can take several months. Not always suitable. Certain medical conditions or insufficient bone density might make someone ineligible for implants. Now, let's shift our focus to dentures. These are removable appliances that replace multiple missing teeth. They can be either a full set, replacing all teeth in an arch, or partial, filling in gaps when some natural teeth remain. Here are the pros of dentures. More affordable. Generally, dentures have a lower upfront cost compared to dental implants. Non-surgical. They don't require surgery, making them a suitable option for individuals who may not be good candidates for implants. Faster treatment time. Getting dentures typically involves fewer appointments and a quicker turnaround time. Replace multiple teeth easily. Dentures are an efficient way to replace a large number of missing teeth. However, there are also cons associated with dentures. Stability issues. Dentures can sometimes feel less stable than natural teeth or implants, potentially slipping or moving, especially when eating or speaking. Impact on taste and speech. Initially, dentures can affect your sense of taste and speech, although most people adapt over time. Bone loss. Unlike implants, dentures don't stimulate the jawbone and can lead to bone resorption over time, potentially affecting the fit of the dentures. Maintenance. Dentures require daily cleaning and soaking, and they may need adjustments or replacements over time. Potential for gum irritation. The acrylic base of dentures can sometimes irritate the gums. Speaking of gum irritation, let's delve into a specific issue some people with dental appliances face: dental bridge gum irritation and its treatment. A dental bridge is another way to replace missing teeth. It typically consists of one or more artificial teeth, pontics, held in place by crowns on the adjacent natural teeth, abutment teeth. While bridges are a stable and effective solution, the area where the bridge meets the gum line can sometimes become irritated. Gum irritation under a dental bridge can occur due to several factors. Food impaction. Food particles can get trapped underneath the pontic, leading to inflammation and irritation. Plaque and bacteria buildup. If the area isn't cleaned thoroughly, plaque and bacteria can accumulate, causing gingivitis, gum inflammation. Poor bridge fit. An improperly fitted bridge can rub against the gums, causing soreness and irritation. Allergic reaction. In rare cases, individuals might have an allergic reaction to the materials used in the bridge. So, what can be done to treat and prevent gum irritation under a dental bridge? Here are some key strategies. Meticulous oral hygiene. This is paramount. Gently brush around the bridge and abutment teeth. Use floss threaders or interdental brushes to clean underneath the pontic where a regular toothbrush can't reach. Regular dental checkups. Your dentist can monitor the health of your gums around the bridge and ensure it's fitting correctly. Professional cleanings can remove plaque and tartar buildup. Warm saltwater rinses. Rinsing with warm salt water can help soothe irritated gums and reduce inflammation. Soft food diet. During periods of irritation, Eating softer foods can minimize pressure on the gums. Proper bridge design and fit. Working with a skilled dentist to ensure the bridge is well designed and fits accurately is crucial for preventing future issues. Now, let's touch upon another important aspect when considering false teeth: maintaining good oral hygiene with dental appliances. Whether you have implants, dentures, or bridges, proper care is essential for their longevity and your overall oral health. For implants, treat them like your natural teeth. Brush twice a day with a soft bristled brush, floss daily, and don't forget regular dental checkups. Dentures require a different approach. Remove them daily and clean them thoroughly with a denture brush and a non-abrasive denture cleaner. Rinse them well before putting them back in your mouth. It's also important to give your gums a break by leaving your dentures out overnight. For bridges, as we discussed, paying extra attention to cleaning underneath the pontic with floss threaders or interdental brushes is key to preventing irritation and maintaining gum health. So, there you have it, a comprehensive look at false teeth options, the comparison between implants and dentures, and how to address gum irritation with dental bridges. Remember, choosing the right option for you is a personal decision that should be made in consultation with your dentist. They can assess your individual needs and help you find the best path to a healthy and confident smile. If you found this video helpful, please give it a thumbs up and subscribe for more wellness insights. What are your experiences with dental appliances? Share your thoughts in the comments below. Thanks for watching, and I'll see you in the next video.